In on the points for allergies, the first point we're going to go over is large intestine 20. This is located at the base of your nose on both sides, and this will relieve maxillary pressure. And it's also used to open the nose and improve breathing. And it's a good point when suffering from rhinitis, sinusitis, or toothaches. So you're going to locate this point just beside the nostrils, just in the little cheek folds here. And you're just going to press in this point for a minute or two. You can even pull it out just slightly, opening up the nostrils, and then you can get the client to take a nice deep breath in through the nose and out through the nose. I like to encourage breath when I'm working with people who have allergies, and I'm also looking to open up everything around the nostrils so that they can breathe a little easier. Hold this point for 1 to 3 minutes, and you can even do some circular pressure with it as well. Urinary bladder 2 is located at the top of the inner edge of the eyebrow. It's right underneath the orbit of the eye. This relieves pressure in the forehead, and it's a good point for blurring of vision, pain in the eye, as well as spasming in the diaphragm. You can use more of a gentle pressure here, but some people do like a little more of a slightly medium to firm pressure in this area. This is one that people kind of tend towards naturally if they're feeling stressed or have a headache or anxiety. I like to place one fingertip down on this area, and you could also do some circular motions here. Hold for a minute or two. For spleen 10, you're going to want to have the person bend their knee. It's 2 finger widths above the inner edge of the kneecap. This is also said to be a good point for painful menstruation and eczema. For this one, you'd want to do both sides at the same time. So locate it on the other knee, and then you'd want to press in and hold this for another minute or two. And since we're trying to open up the breath, you can get them to take some nice deep breaths in through the nose and slowly out through the nose. If they can't do that, you can get them to take a deep breath in through the nose and out through the mouth. And then upon the inhale, slowly remove your pressure from the 2 points. This edge and the inner edge. This point is also used for sore throats. Now, a tip is to treat all these points at the same time. I can pinch this muscle, and I can get the client to come back to neutral into a relaxed position. So I'll get them to bring their head back, and then I can just pinch the muscle on both sides. Now, if the client is experiencing any difficulty or this technique is irritating, and you do the 2 levels and they don't enjoy it, you can also just get them to turn again, find the SCM muscle, and then you could do some nice fingertip kneading along that muscle belly to help relax the points along this meridian. Conception vessel 22 is on the middle axis above the bony edge of the sternum, right in the midline. So locate the midline, find the sternum, and then once you've found it, you're going to press in like this along the bony edge. You're going to want to provide a slight downward pressure with 1 to 2 fingertips, or you can use a reinforced thumb in this area as well. This is a good point for relieving pain in the upper chest and for swallowing issues. You'd want to hold this point for about a minute or two, and some people like a gentler pressure in this area. It's a very sensitive area, but some will also take a more of a medium pressure in this area as well. You can massage across the top of the forehead just for relaxation and to relieve any sinus pressure and also anxiety, and this is good for relaxation. After you've done that, you can locate Yin Tang 1, which is in between the two eyebrows. You can lift this point slightly, which is nice and relieving. And then you could also do some nice circular clockwise motions for relaxation for 1 to 2 minutes. And this is one of the key acupressure points and one that I find everybody really, really loves. The first point we're going to look at for stress and anxiety is pericardium 6. Measure 3 fingers below the wrist and then go in between the 2 tendons. So here you can place your 3 fingers down, find where that point is, and then place your thumb down. You can lift the wrist to pop up the tendons, and you want to get in between the 2 tendons. Research has shown that this point is effective for treating nausea. Now you want to hold this point for 1 to 3 minutes, and you could even work with the breath as you are on this point just to help increase that feeling of relaxation and to decrease anxious thoughts. Yin Tang 1 is located in between the eyebrows, and this is also known as the third eye. With this point, you want to rub in a circular clockwise motion for relaxation. This point has been shown to be good for stress, anxiety, as well as cardiovascular conditions. You can also work with the breath at this point, and that will once again help the client or whoever you are relax. Ren 17, the Sea of Qi, is located in the front of the sternum along the midline. It's going to be in between the 2 nipples, right in the middle of the chest. With this point, I like to use 3 fingertips, and I'll press down quite gently, and you're looking for the tension in the chest to ease away. You're looking for it to slowly unwind. So here I'm pressing down, I'm using more intention than anything, and I'm allowing the tissue in that area to relax. This is used a lot in myofascial release. If you've taken workshops, you might know this technique, and it works absolutely fantastically. I use it all the time on myself. I absolutely love this point. It's completely amazing for relaxing the body. Hold this point with the 3 fingertips for 1 to 3 minutes. Use your intention to drop down into the point and focus on allowing it to unwind and relax. Before going in and working on the massage points for digestive issues and constipation, I like to do a nice little belly massage, and this just helps to warm up all the tissue. With this, you want to place a little bit of oil down on the abdomen, not too much because you don't want to slip off the acupressure points. Then you can approximate the tissue. This helps to relax any tense tissue in the abdomen. So I'll take both sides and bring the abdomen together and hold there. You can even pull through here, creating a stretch in the tissue while approximating, which is really relaxing. Follow that all the way through and then start your massage working from the right side to the left side. On the right side, you're working up the ascending colon, and then you're going through the transverse and then down the descending. This is absolutely fantastic for constipation. It helps to get things moving in the abdomen. And it's also just really relaxing to massage the abdomen. Follow that through, do it a couple of times, and make sure you follow through all your strokes. And then you can come up and just do a nice full stretch of the abdomen, placing your fingertips down and then gliding all the way down from the bottom of the ribs in towards the bladder. And then you could do some ringing. Here, what I'm doing is I'm just going from side to side, and this feels absolutely so good for anyone who has gastritis, and it's good for just opening up the circulation in the area, and it's going to make the acupressure points more effective. You can do this 3 to 5 times, just moving back and forth on the abdomen while also stretching out around the lower ribs. Stomach 25 is known as the most important point for intestinal disorders. It's located at the level of the navel. So find the navel, take 2 fingertips, and then locate the point. Once you've found the point, press down in that area, and then find the adjacent point on the other side. With this, you can do some nice static pressure, and you could also do circular pressure in a clockwise motion for 1 minute, and then move in a counterclockwise motion for another minute. Repeat as necessary until there's some abdominal relief. This is a really useful point for constipation, diarrhea, as well as gastrointestinal issues. I can't stress enough how much this point is important for those issues. Stomach 36 is located 4 finger widths down from the bottom of your kneecap along the outer lateral boundary of the shin bone. So place 4 fingertips down, find that point, press down, and you're just going to find it off the shin bone. You're going to roll off onto the tissue, and then you're going to press down on both sides. Hold this point for 1 to 2 minutes. Treat both legs using your fingertips, thumbs, or even palms. And this is a good point for gastric pain, coughs, asthma, as well as on an emotional level, it's supposed to be really good for depression. Hold this point, work with the breath. If someone has abdominal issues, constipation issues, they're most likely going to be anxious and stressed as well. Work with the breath, hold the points, and then wait for relaxation. And then slowly upon the inhale, work away and lift off. Stomach 41 is located in the depression in the middle of the front fold of the ankle. So find the bone on the side, the lateral malleolus, and once you find that, just travel all the way through the midline, and you're going to find this in between 2 tendons is what it feels like. So get to the midline right around the ankle there. You can even bring the foot up into dorsiflexion, lifting the foot up there, and then find the point in between, right in the middle of the ankle. This point is going to be really good for constipation, headaches, as well as locally, it's going to be good for pain in the ankle. Press on both ankles at the same time. You can do some up and down pressure or circular pressure, whatever you prefer. Practice both. And then wait 1 to 3 minutes. Starting in on the points for painful menstruation, the first ones we're going to look at are liver 3. This is known as the happy calm point. It's located on the top side of the foot, the dorsal side, and it's between the first and second metatarsals. Spread the toes and then travel up the webbing in between until you hit the end, which is going to feel like a bone. It's going to stop you from moving forward. Once you hit that bone, just go down slightly and press down in that area. You can press down on both feet at the same time. And this point is used to release resentment, and it's also used for anger and insomnia. Hold both of these points for 1 to 3 minutes, and you could go up and down on this point, or you could also do a circular motion. But because of the way it's situated, I like to go up and down and press on both points at the same time. The next point we're going to look at is large intestine 4. If you are pregnant, do not use this point. This point is used to induce labor. Unless you're trying to induce labor, then you could use this point. It's located on the back of the hand between the thumb and the index finger. Use a medium to firm pressure on this point for 1 minute with deep breathing and repeat on the other side. This point is good for stimulating the immune system. So to find this point, you're going to travel in between these two, and then you're going to come across a bone. It's just going to stop you on this side. Once you've hit that bone, you're going to want to curl your thumb off. You can even pinch on the other side of the hand like this. And then you could hold this point for 1 minute with deep breathing. You can do some nice circular kneading at this point. If you find that it's too hard on your thumb, you can take your fingertips, locate the bone, curl inside, and use your fingers as well. And those are just a couple options for large intestine 4. Stomach 25, known as the most important point for intestinal disorders, is located 2 finger lengths to the side of the midpoint of the navel. And with this one, you can locate it, press down, place your thumb down, and then you'll know where to go on the other side. And then you could press down with a medium to firm pressure and do some nice clockwise movements for 1 minute, and then counterclockwise for another minute. And you could repeat this as necessary. Rubbing over the sacrum is said to affect the urinary bladder meridian. These points affect the lower abdomen and are also good for menstrual cramps. Rub the skin back and forth for 3 minutes to increase warmth. You can do this in a circular motion, or some people go back and forth like this. I just find it's a little more relaxing with a circular motion over the area. A good point for urinary issues is going to be liver 3. It's on the top side, dorsal side of the foot, between the first and second metatarsals. So you can split them, then place your thumb in between. Then you're gonna just go up until you feel bone at the top there, and then just go down slightly. You can press on this point on both feet at the same time, and you're gonna hold this for about a minute or 2. And then after they've done some nice deep breaths in and out, on the inhale, you're gonna slowly come off that point. And then you're gonna travel up to the next point. So you can do some nice circular kneading. You can do this on both sides if you like. And you're traveling up, and you're gonna find the medial malleolus bone. You're gonna place your hand down here, and then 4 finger widths above on the inner leg, you're gonna find spleen 6. So it'll be just off the shin bone. You can use a lighter pressure in this area because it can be a little bit sensitive. So you can locate that on both sides, press down, and then do some nice circular motions. This point crosses the spleen, liver, and kidney meridians. It's said to help with regulating menstruation and also a helpful point for any gynecological issues. For sinus pain, start with a facial massage. You can move around the maxillary, ethmoid, and also frontal sinuses. You can start below the eyes and the cheeks and just move from the midline outward, just gently massaging, trying to relieve some pressure in that area. Go a little bit higher just underneath the eyes and just gentle move away from the midline into the sides, draining everything. You can do a nice massage around the face, around the nose and the eyes. That's really relieving and relaxing. Then in the eyebrows, just over the eyebrows, you can come across the face. You can go a little bit above the eyebrows and even into the top of the head. You'd want to repeat that about 3 times. And make sure to use kind of a gentle pressure here. If people have issues with sinuses, they're going to be quite sensitive. After the massage, you can start in on the points. First one we're going to do is large intestine 20, located on both sides of the nose beside the nostrils in the cheek fold, right around here. You can do some nice circular motions in this area, and you can treat both points at the same time in a nice circular, steady pressure. From here, you're going to move up to Yin Tang 1. In between the two eyebrows, you can do a little bit of a reinforced fingertip. Locate this point, then use some nice circular pressure, and you could hold that for a minute or two. After you've done that point, you can move on to urinary bladder 2, located on the inside edges of the eyebrows, right around here. And this is also a good point for allergies and anxiety. After you've hit that point, we can get into urinary bladder 10, which is located on the back of the head. So I've just got the client in seated so I can show you guys specifically where this point is. So this is located on the back of the head in the suboccipital muscles. For massage therapists, you guys are going to be well acquainted with this one, but for other people, I'm just going to show you. So it's just under the base of the skull, and you're going to treat both points at the same time. So you can place your thumbs here. If you were doing this in lying on their back, then you would have about 3 fingertips in this area, and you'd be massaging like this. But for now, locate the base of the skull, place 2 thumbs down, and then you just do some nice circular motions in urinary bladder 10, which is an important point for headaches, feelings of vertigo, and also for sinus pain. Lung 10 is located on the outside edge of the ball of the thumb at the base of the thumb on the midpoint. So in between this point here is lung 10. Now you're just going to be kind of inside and then on the edge here. And then you can massage this point for 2 to 3 minutes in a nice circular motion. You can use a reinforced fingertip if you want to not strain your thumb. And this point is also used to treat emotions of sadness and melancholy. From here, you can massage up the thumb to the middle of the outer arm to get to our next point. Lung 6 is located with the palm side up. It's on the midpoint of the lower arm, along the line from the thumb side of the wrist to the elbow crease. So it would be right around here. This is a good point for forearm pain, and it's also indicated for anyone who has coughs. You can hold on this point and place a reasonable amount of pressure and just do some nice circular kneading for a minute or two. And then from here, we're going to massage up the mid to outer arm in this area. And we're going to go all the way up into the pecs, and we're going to get to our next point, lung 1. So lung 1 is located on the lateral upper portion of the chest. It's about 6 finger lengths away from the midline. So you'd place 4 fingers here, 2 here, and then you know it's right here underneath the clavicle. You can pinpoint that point, find it on the other side, and then with this one, you'd want to treat both points at the same time, and you can use the breath as you work through this technique. So you can get the client to take a nice deep breath in and out, and just provide nice circular, relaxing motions as you work through both of these points. This is said to be a good point for relieving any issues with the lungs, chest pain, and also for restoring vitality. So you'd want to do lung 6 on this side of the arm as well, after you've done one side of the arm and both of the chest points. And then you would also do lung 10 in the lateral portion, kind of inner lateral portion of the thumb, just to make sure to complete the treatment. Once again, you'd want to do all these points for about 1 to 2 minutes. For headaches and migraines, you're going to want to go after large intestine 20. This is located on both sides of the nose, beside the nostrils, and it's in kind of the cheek fold right around here. Now you can press both of these points, and then you can kind of like spread out a little bit, opening up the nostrils. And then you could use a nice circular motion and a steady pressure for about 2 minutes. And you can get the person to take a nice deep breath in and out through the nose as you work through this acupoint. Yin Tang is located in between the 2 eyebrows, and this is in the 3rd eye. This point helps with eye strain, and if you pull up slightly and then just do a nice circular, even pressure for 1 to 3 minutes, it's incredibly relaxing. This is a lot of people's favorite point. Urinary bladder 2, located on the inside edges of the eyebrows. You can place fingertips down here. And here it's a little bit more of a sensitive area, so you can use a lighter to medium pressure depending what people like. Now with this one, you can also do some circular motions and hold it for 1 to 2 minutes. This is a good point for anyone who has eye strain. With gallbladder 20, this is going to be located at the base of the back of the head on both sides of the middle axis beside the suboccipitals. So this is the middle axis just underneath the base of the skull. And right here would be the suboccipitals. You move slightly outer or laterally, and right about there should be gallbladder 20. Now I'm showing you guys in seated, but of course you can do this to yourself in seated, or you could do it to a client with them lying on their back. Now you'd want to hold this point for about 1 to 2 minutes. And this is a good point for headache relief. So massage it in a circular motion for 1 to 3 minutes. And that should definitely get most people some nice relief for their headaches. Gallbladder 21 is located midway from the neck to the end of the shoulder in the upper portion of the upper traps. So it would be right around here. A lot of you will know this as a common trigger point for people. And this is a good point for anyone who has a stiff neck or sore shoulders. With this one, you can definitely place a little more pressure down. You could do this technique in seated as well as supine on their back. Hold this for about 1 to 3 minutes, but sometimes it can take even as long as 5 minutes for this point to really ease up and to get neck pain relief. Large intestine 4 is an amazing point for headaches and migraines. It's located in between the thumb and the index finger. And with this one, you travel up until you feel kind of a bone at the end here, and then you go slightly lower and press down. With this one, you can hold it for about 1 minute and use some nice deep breathing as you work through this point. You're going to want to do it on both hands. And this point is also good for stimulating the immune system. For nausea, the best point that most Chinese medicine practitioners are going to tell you is pericardium 6. Measure 3 fingers below the wrist, and then it's going to be in between the 2 tendons right around here. Try to get in between the 2 tendons, and then you're going to massage this point for 1 to 2 minutes. Perform it on both sides, wrists, And this seems really simple, just one point, but people report that this works extremely well. And I think personally that this is the best point for nausea. For better sleep, Heart 7 is supposed to be one of the best points. It's said that manipulating this point is believed to increase melatonin production in the body. It's located on the inside ulnar aspect of the wrist in line with the pinky finger. It's on the underside of the wrist crease. So you're going to want to press down in that area. And this point is also good for stress, anxiety, and for insomnia. So you're going to want to hold this point for 1 to 3 minutes. On Mian is a point that's located behind the earlobe, just behind the bony protrusion with the outer edge of the top of the SEM muscle. So to locate this, you can actually get the person to turn and then kind of bring their head to the side. You'll see the SEM muscle pop up. Behind the earlobe, there's going to be a bony protrusion. And then just underneath of that, you're going to press in right around here. You're going to do some nice circular motions. And you could hold this one for about 30 seconds using deep breaths as you hold the point, which will help you to ease into the relaxation and will help with better sleep. Another really good point for sleep is going to be Yin Tang 1, located in between the two eyebrows and the third eye. For this one, you can place a fingertip down, reinforce the fingertip, and then you could do a nice even circular pressure for 1 to 3 minutes. This point also feels really nice to kind of lift up, just gently getting a nice little stretch there, and then do the circular motion. To enhance the relaxation with this technique, you can do some deep diaphragmatic breathing in through the nose and slowly out through the nose. If you're feeling particularly stressed, you can also do a deep breath in through the nose as you massage this point and sigh it out through the mouth. Hold for as long as you need to feel relaxed. For neck pain, massage the muscles in the posterior neck using circular motions to start just across from the spine. And then you could use a slow, steady pressure, just pulling out from the midline and massaging around the cylinder of the neck. Do this for a nice minute or 3, and then work on the acupressure points. Gallbladder 20 is located at the base of the back of the head on both sides of the middle axis beside the suboccipital muscles. So for this one, you're going to find the base of the skull. Here's the midpoint. Move off a little laterally and then move off just a little more laterally, and that's gallbladder 20. You can massage both sides with your thumbs, or if you were lying down, you could use your fingertips. And with this one, once again, hold for 1 to 3 minutes. This is a really good point for relieving headaches and pressure in the neck. From there, you can move down to gallbladder 21. So you can do some nice massage down the neck. And with gallbladder 21, it's in the upper traps between the neck and the end of the shoulders, just in the upper portion, right around here. This is a good point for neck stiffness and also any disorders of the shoulders. With this one, you can place a little more pressure down. I like to go back and forth. Sometimes I'll do circular motions if I want it to be more relaxing, but just know that you can use quite a bit of pressure on this point. Lao Zhen is a point found on the back of the hand in the depression between the second and third finger tendons. So second and third finger, find the webbing, travel up, and it's right around here. Now for this one, place your finger down in between and then just wait for 1 to 3 minutes. You can rub back and forth. A lot of people like to do that. And this is known as an extremely powerful point for neck pain. Try this at home. If you have any neck stiffness or pain, just rub back and forth for 1 to 3 minutes and see if you get any relief. For chest pain, these are going to be points used for tension in the chest, either from stress or tight pectoral muscles. Hold each point for 5 to 10 deep diaphragmatic breaths. Heart 7 is going to be the first point. We talked about it being great for increasing melatonin production. Well, it's located on the inside of the wrist, in line with the pinky finger, on the underside of the crease of the wrist, right around here. Press this point and then hold for 5 to 10 deep diaphragmatic breaths. On the last inhale, slowly release your pressure. Lung 6 is located on the thumb side of the lower arm. It's on the midpoint of the lower arm along this line from the thumb to the elbow. So right around here, draw a line. Right in the middle, right here would be lung 6. Hold this point for 1 to 3 minutes, massaging in a nice circular motion. You could do reinforced thumbs as well, just for comfort as a massage therapist or for anyone who's doing this technique. Kidney 27 is located on the hollow beneath your collarbones. It's about 2 finger lengths from the midline on either side. So go like this, and then you'd pinpoint that point. You know this is the point. So you'd want to go just underneath the collarbone here. And then this is used in Chinese medicine for people who get respiratory infections, and it's said to help with feelings of fear and anxiety. Hold this point, and then also work with some nice deep diaphragmatic breaths. So 5 to 10 deep diaphragmatic breaths as you hold this point. To relieve anxiety, it's also nice on the last breath to get them to exhale through their mouth. And then on the exhalation, slowly remove your thumbs. For back pain, large intestine 4, which is in between the thumb and the index finger, what you're going to do to find this point is to press, move your way up until you feel a bone in between these 2 points. Then you're going to want to go a little bit lower and press on this point with a medium to firm pressure for 1 minute with deep breathing. You're going to want to repeat this on the other hand, and you want to apply a consistent pressure. This point is particularly good for low back pain. For gallbladder 30, draw a line from the lower edge of the glutes into the greater trochanter, a little bone here on the side of your hip, like this. It's going to be located in between those 2 points, right around here. You can place a thumb down or 2 fingertips if that's more comfortable for you. You could do this on both sides once you've located the point, and you're going to want to hold both points for a couple minutes. This is a really good point for sciatica-like pain or pain in the lumbar back area. For governor vessel 3, this point is located below the 4th lumbar vertebrae. Locate this point by locating the iliac crest, so the top of the hip bones. And once you've located the top of the hip bones, go right into the middle like this. What you're going to do is you're going to find that point, and then you can place your palm down over that point in somewhat of a downward pressure, and then just do some nice gentle palm rubbing here for around 3 minutes. And this is said to be really good for low back pain. And the final point for back pain is going to be governor vessel 14. This is called the great hammer, and this point is located below C7 on the spine. C7 is the 7th cervical vertebrae, and it's one which is the most prominent on the bottom of the neck. By bending the neck forward slightly, you should see it start to pop up. So we can see right here, it's starting to pop up. So you can locate it and then just go just underneath it, get the client to come back up to neutral, hold your thumb there. And traditionally, the cervical vertebrae were referred to as hammers because of their resemblance to the tool. This point is really, really awesome because it's the intersecting point for all of the yang meridians in the body. In wintertime, this point is often used to treat colds and other illnesses that are common for that time of year. Massage the point in a clockwise manner for 1 minute. Holding here, you can even do a reinforced thumb. So massage in a clockwise manner, and then a counterclockwise manner. You can do this with a lighter pressure since it's just underneath the spinous processes in between. And this is also said to be a good point for toothaches and sore throats. For large intestine 14, you're going to find the bottom of the deltoid muscle, which should be right around here. Now you can roll off the deltoid, find the bottom, and find the middle, and then you just want to go slightly medially to the middle, right around here. Now you can press down on this point for 1 to 3 minutes, and you could do some nice circular kneading as well. This is said to be a good point for lymphatic drainage problems at the neck, or for feelings of weakness in the upper arm. You want to hold this point, and then after you've completed this point on this arm, you want to make sure to do it on the other arm as well. A large intestine 15 and triple warmer 14 are on either side of the deltoid. Large intestine 15 is at the top of the deltoid in the front depression of the shoulder, and triple heater 14 is at the top of the shoulder in the deltoid in the back depression. These 2 points can be massaged at the same time. So you can take 2 fingertips on this point here in the front and 1 in the back, and then you could do some nice circular motions, or you can go up and down, massaging both of these points at the same time. And this is going to be really good for anyone who has frozen shoulder. Lung 2 is located about 6 finger lengths away from the midline, right around here, and it's going to be underneath the clavicle. This is located in the depression just underneath of that clavicle there. With this one, it's said to be good for a fullness feeling in the chest, and it helps to stimulate lung qi. You can press in on both points at the same time and do a nice circular motion. You could also work with deep diaphragmatic breaths in this point, making sure to do about 5 to 10 deep breaths as you work through both of these points at the same time. Gallbladder 21 is located midway in the shoulder from the neck to the end of the shoulder. So it's right around here in the upper traps. Now you're going to want to do this point on both sides at the same time. You can use some thumbs, or you can use your fingertips as well. I like to use my thumbs in this area. With this point, you want to hold for 1 to 5 minutes. Sometimes it takes a little bit longer to release this point, and you can do some nice circular motions, and also use your body weight to bring your thumb more into the muscle. Hold with a firm, steady pressure, and then release on the inhale when you're done the 1 to 5 minutes. Small intestine 11 is located in the middle point of the shoulder blade. So locate the top and the bottom, and then right in the middle portion of the shoulder blade on both sides is small intestine 11. This is said to be a good point on an emotional level for releasing mental chaos, for increasing mental clarity. So at this point, you're going to want to hold for 1 to 3 minutes. You can do some nice circular motions in a clockwise manner for 1 minute. And you can also do for the last minute counterclockwise. And then finish with a static hold for 1 minute. Starting in with the elbow, if someone had an acute issue with the elbow, inflammation, you could always put ice over the area. And that's something you can instruct them to do at home if they ever injure their elbow. But if it is a chronic case of tendonitis or pain in the elbow, you'd want to do some massage first. So you can work on the flexors, the extensors, up the arm, and then in towards the pecs. So for the flexors, you can use your thumbs, fingertips, and it's nice to create a little bit of movement as you work through the tissue. So I like to kind of place my thumb down here, one thumb here, and then I'll stretch as I work through the tissue. And with this, you're just looking to increase some circulation, warm up all of the musculature before you go in and do the acupressure points. You can do some circles with your fingertips, just going up the extensor muscles around the elbow, just stretching that tissue out, working up the outer arm, and then in towards the shoulder. And this is just a nice way to relax all this muscle before you do the acupressure points. The first point that you're going to work on for elbow pain is going to be large intestine 4. This is between the thumb and the index finger. Use a medium to firm pressure. So you're going to travel up the webbing until you reach kind of this ridge towards more the index finger. Then you're going to press on that bone and then curl off a little bit right at the top there. Hold this point for 1 minute with deep breathing. Repeat on the other hand and apply a consistent pressure until the pain subsides. This is used for low back pain, elbow pain, and also jaw pain. Traveling up the arm from large intestine 4, we're going to go to large intestine 11. Bend the arm like this, and then look for the crease in the outer side of the elbow. So it's right around here. You're going to press in on this point right here with the elbow bent. And you're going to massage in this point with a circular pressure. And this is known as one of the strongest points for clearing heat in the body. Think of this point as a great vent for the body, and it's very grounding and great for anyone who has a lot of inflammation in the elbow. Hold for 1 to 3 minutes and then gently release your pressure. Triple heater 10 is the next point we're going to hit. With the elbow bent, it's in the indentation behind the elbow. So this is the olecranon process. Take 1 finger width down, press in here, and that is triple heater 10. This is a good point for elbow pain and especially tendonitis. It's said to remove dampness and phlegm from the body, and it also helps to calm the mind. You'd want to do this on both sides or whatever side is affected in their elbow. So let's say the client is affected on this side, you could just treat this side if you want to. Press down for 1 minute to 3 minutes in this point, and then slowly release. Traveling up from the last point behind the elbow, we're going to finish the elbow point series right here with large intestine 15. This is located on the outermost point of the shoulder, just below the bony protrusion between the front and middle portion of the deltoid. So it's right around here. This is one of the best points to treat for any shoulder pathology. You can do a nice circular motion in this area. Some people, if they do have a shoulder pathology, will be quite sensitive here. So just check in with your client to make sure the pressure is okay. You'd want to treat this point for 1 to 3 minutes, with a nice circular clockwise pressure if you want to induce relaxation, or if you want to have a balanced feeling for all of the aches and pains in the elbow. You would then do counterclockwise for 1 minute, and then static for another minute, and then leave the point. When it comes to hand pain, you're usually going to have people that have numbness and tingling in one side of their hand. So it's good to do a little bit of massage in the hand before you go in and do the acupressure points. I'll use my body weight here to drop down into the hand. So I'm using my thumbs, but I'm actually just dropping my body weight down into these techniques. And you're spreading around the carpal tunnel. You can use your knuckles to spread around the hand if you want to save your thumbs. And that's a really nice way to warm up this area before you go in and treat all the individual acupressure points. Pericardium 7 is located in the middle of the wrist, in between the tendons of the palmaris longus and flexor carpi radialis. So these two tendons right here, right in this wrist crease, right here, you guys can see the line. You can place your thumb down in between the two tendons right here and hold for 1 to 3 minutes. This is known as a cooling point, and it's good for carpal tunnel syndrome, nerve pain, or numbness and tingling in the hand. You could also bring the hand in a little bit like this for more of a positional release, which helps to relax the tissue right here. So when you're pressing on the point, just bring the hand in a little bit, and that will help to relax the tissue a little bit easier. And you'll find that you won't have to hold the point for as long. So usually if you do this, you only have to hold it for about a minute, and the tissue will start to ease up, and there'll be some relaxation around the hand. The other primary point that you'd want to treat for hand pain is going to be lung 10. This is located in the hollow of the pad in the ball of the thumb. So it's in this upper portion right here, right in the middle. And then what you're going to do is gather the tissue and then place your thumb down right here like this. You can place one fingertip down on the other side. This is a fantastic point for anybody who does any type of work with their hands, painters, woodworkers, and especially massage therapists. If you're someone who's affected by pain in the hand, this could be a little bit sensitive. It's one of those hurt so good kind of things. But if you do press down with a firm pressure for 1 to 3 minutes, it'll start to slowly dissipate. You can also do some nice circular motions here with a nice firm, steady pressure, and keep doing that for 1 to 3 minutes. And eventually the pain in the thumb is going to go away. After you feel the pain subside, slowly come out of this technique, very slowly. Slowly go into the point. Use the bony point of your elbow to get into the muscle. Slowly sink in, and then you can go back and forth, holding this for 1 to 5 minutes. And this is a good point for weakness and numbness in the lower extremities. For leg pain, the first point that we're going to hit is gallbladder 31. So this is going to be on the lateral outside part of the leg. Take 8 fingertip lengths away from the knee and locate the point right here. It's going to be at the midpoint of the leg. If a person was standing erect, it would be where their hands would be hanging off their sides, just where the middle finger would touch. Okay, so hold this point. You can use your thumbs. You could even use your knuckle for this point because the IT band in this area is so strong, so you can use a knuckle and then anchor above. And you could hold this point for 1 to 5 minutes. It's a strong point. Sometimes it takes a while to release. And targeting this point is good for pain and paralysis in the leg. Hold this point, communicate with the client. When they feel like it's starting to relax, you can slowly ease off and then do the other side. So traveling down from where we just were, we're going to go to stomach 36. This point is going to be 4 fingertips from the knee right here on the outer aspect of the leg. And you're going to feel the shin bone right here. And then just off that, you're going to press down into the muscle tissue. Now you'd want to treat this on both sides. And this is a good point for knee pain, gastric pain. I've actually had clients who have had pain in their knees for years, and you target this point, and if you hold it for a couple minutes, the fullness feeling in their knee will start to go away. So it's one of those magic tricks that can really work wonders on certain people. Hold this point for a couple minutes, communicate with the client, see how they're feeling. You can even do some nice circular motions here. And then once it feels like it's relaxed, slowly remove your pressure. And with this one, you could do both sides at the same time if you're standing, or you could just do one side if that's the side with the pain. So we're going to travel from stomach 36 to stomach 38. So stomach 36 was 4 finger widths away from the knee. This one is going to be 8 finger widths away on the outer aspect of the leg. So go like this, landmark it, place your pressure down, find the shin bone, just go to the outer leg right around here. So for this one, you're going to want to do both sides at the same time, or you could do the affected side. But it is good protocol to do both sides. Hold this one for 1 to 5 minutes, communicate with the client, see when the pain starts to dissipate if there is local pain on the area. And this is a good point for weakness and numbness in the lower extremities. The last point that we're going to do for leg pain is governor vessel 3. This is just below the 4th lumbar vertebrae. To landmark it, you can find the hip bones, the iliac crest, and then once you find it, just go to the midline like this, and then you're just going to go slightly below. With this technique, I'm going to take my palm, so I'm going to take this part of my palm, I'm going to lay it down over this area, and then I'm just going to do a gentle circular pressure for 1 to 3 minutes. And this is said to be really good for sciatica and any numbness or tingling down the legs. So if you do this little massage and hit the other 3 pressure points, it's going to work wonders for leg pain. For knee pain, you're going to want to treat stomach 34. With the knee like this, you can also bend the knee if you want to find this point, but you can place 2 finger widths on the upper outer edge of the knee, and then the point is going to be right around here. So once you've found that point, you can hold for 1 to 2 minutes. And a lot of times there can be referral from this point down into the knee. So this is a nice point for anyone who has a fullness feeling in the knee. Now you can also use a reinforced fingertip here, or if you're really good and skilled with your elbows, you can also place your elbow down on this area and then slowly push in and hold that pressure, or you can do some nice clockwise motions as well. This point can be a little bit sensitive, especially if someone has pain here, so just be aware of that. So we're going to travel from stomach 34 to stomach 36. So traveling down, we're just working our way down, and it's going to be 4 finger lengths away from the knee. So 4 finger widths. Place your finger down here. It's going to be about 1 finger width off the shin bone. So right around here is the point. You can treat both sides once you see where the point is. And with this one, follow the protocol, 1 to 3 minutes. This is another great point for any people who have fullness feeling in their knee, anyone who has chronic knee pain that they can't quite discover what's going on. This point can sometimes be a magic trick. Urinary bladder 40 is located behind the knee. So with the knee slightly bent, feel into the hollow behind the knee. So I'm going in behind the knee here, and I'm feeling in the hollow portion. Now this seems like it would be incredibly sensitive, but if you get it right, it shouldn't be that sensitive. This is a good point for hip and foot pain, and it's known as the command point for the low back. So yes, it will also help with low back pain. Communicate with the client, make sure they're not getting any numbness, tingling, any type of nervy sensation with this. It shouldn't feel like that. And if you're in the right spot, this can take a little bit of practice, but practice on yourself. Just go in the hollow behind your knee, and that's a good way to test and practice for this technique. Once you've held it for about 1 minute to 3 minutes, you can then slowly come out of this technique and bring the leg back to neutral. Spleen 9 is located on the inner lower leg. Take 3 fingertips away from the kneecap, right around here. So you'll feel the shin bone right here, and then just move a little bit more in once you're off the bone. So it should be right around here. You can use a reinforced fingertip. This area of the lower leg can be a little more sensitive, so you can always approximate the tissue if the client or yourself, if you're feeling sensitive at this point, you can take the muscle around the area and kind of just bring it into your fingertip. So squeeze it, bring it into your fingertip. That will help to relax the muscle a little bit faster. And you'd want to hold this point for 30 to 90 seconds. This is a good point for anyone who has period pain or urinary bladder issues. After you've done holding the point, slowly release, and you could do both points on both sides of the lower leg. So you can do one at a time, or you can do both at the same time. That's just up to you. Liver 8 is located along the knee joint in the medial aspect. So you'll feel along the knee joint, and then right when you hit this kind of soft portion right here, right off the kind of harder portion, that's when you're gonna know that you're on liver 8. This point can be sensitive, so you can stabilize with one hand on the knee as you do this. This is definitely a point that I would do one side, then the other side. Don't do both at the same time. And just press on this point for about 1 minute. Once again, this can be a sensitive point, so communicate with the client, see how they feel, and if it's too sensitive for them, you can avoid this point.